live with Sally Warren and Jayne Freeman, and this is our doula discussion. Yay, woohoo!
Yeah, we're so excited. Explain, who is a doula? What is a doula? What do they offer to new moms?
Okay, so a doula, if you want the actual definition, is
What's the definition?
It's just the Greek word for servant, really. That's where it comes from. And so the way we use it is a woman who serves another woman in a reassuring, nurturing, non-clinical way. I think that's where there's a lot of confusion, actually.
Yes.
People, because in the United States, midwifery, even when I say that, that sounds kind of like sort of,
Right.
kind of from the Middle Ages. Midwifery and midwives are not widely used. We really have an obstetrical model in the United States. So people confuse midwives and doulas all the time. I get this question constantly. So let me clarify, because it's very simple what the difference is. The difference is actually huge. A midwife is a clinician. She's just like a doctor delivering a baby, except she doesn't do surgery. So she does prenatal care, she can handle everything concerning the birth, she can work in a hospital setting, she could work at home, she can work in a birthing center, as long as she can't just be some rogue person who's just got, her license in her back pocket. Midwives are part of their own practice, and they have privileges at given hospitals where they have backing OBs who are part of the practice or who are affiliated with the hospital and the practice, who handle anything that becomes more complex.
That's an awesome way to explain it.
Well, so that's just the midwife section.
So now we get to the juicy stuff.
And there are all kinds of midwives. I mean, in this area, you can't be a midwife in a hospital unless you have a license, a license and you're an RN and so forth. There is something called a lay midwife, which is an unusual term, which basically means a midwife who doesn't have medical training but learned in the traditional way, which is from other midwives. I mean, don't forget, midwifery has been around since the beginning of time. Yes. And the United States, again, was just not a country that embraced it as we found our own way. Just from the time that we had colonies here, and it just was that wasn't really the model. So in Europe and many other countries, midwifery remains the model of care.
Yeah, it's true.
In England, my midwife used to come around on a bicycle.
Oh, I love that.
Isn't that wonderful?
It's like call the midwife.
Exactly.
Oh, I love it.
Yeah, that's great. Right, seen as a little bit more like home-based, kind of earthy, a little bit less hospital-centric and so forth.
Yes.
And, so that's changed considerably. And actually, at the sort of turn of the century in the United States, there was a smear campaign against midwives saying, do you want this woman to deliver your baby? And they would, picture like a woman with like a, babushka, kind of like a rag on her head and looking like a grandmother who wouldn't have had medical training was the idea. And so they brought women into the hospitals in droves, telling them that this was a safer place to be. Now, all of this relates to doulas because a doula is non-clinical. She doesn't do exams, she doesn't take your blood pressure, she doesn't do anything clinical. She's there for support. So there are postpartum doulas, that's what I am. Postpartum simply meaning after birth, doesn't mean depression. And there are birth doulas who are there to support you before you give birth, at your birth, and also all birth doulas come to visit you at least once after you've given birth, just to see how you're doing, if you're healing well, if you have any questions, and to help you with breastfeeding. Whereas the postpartum doula, that's really her whole role, is to take it from there. As a postpartum doula working with women afterwards, that is my primary concern, is to see how feeding is going. And most women want to breastfeed. That is their goal.
Yay.
It's been entrenched in our sort of culture now that the breast is best and this is the way to go. And while we do know that, it's not, as you said, it's not easy for everyone.
It's not easy.
It's painful as well.
It can be painful.
There's
There's a
not
whole
for everybody.
right, but there's
Yeah.
a whole array of potential complications.
Exactly.
Some are minor and can be fixed easily with, say, a nipple shield or a good pump or a better shaped flange for the pump, or a better size rather. And others are more complicated, involving the ability of the baby's tongue to be stretchy and move high up to the palate.
Wow.
When we see that women have a lot of pain in breastfeeding, it's usually about how the baby latches on. Like,
Wow.
if this is a nipple, if I shallow latch...
I'm just going to close up
Sure.
on this so people, this is important information. Okay.
This is so
This
important.
is really
So
specific.
if this is the nipple, this isn't a very good, interpretation, but a shallow latch pinches the nipple because it's not being brought up to the palate.
And you want it to be brought up.
All the way to the back of the palate, like where hard palate meets soft palate. So when it's in deeper and the baby latches on, it doesn't hurt, or it certainly doesn't pinch and make the woman wince in pain. So that's a big piece to breastfeeding that can get very complicated very easily, and in the sense that if she just doesn't have the right latch or the right position, or the baby is incapable based on the architecture of the baby's mouth to get a good latch, then you start with nipple pain. Then you have a woman who doesn't want to continue breastfeeding. Then you have a decrease in milk supply. And then you have bleeding, cracked nipples. And who wants to get a baby latched onto that?
That sounds
It's already-
horrible.
It is
Horrible.
horrible. It's already sensitive tissue, and then it becomes damaged. You know, it's something that's happened in my practice a lot. Somebody will text me in a panic because the baby has spit up and there's blood in the spit up. Now that sounds really
Whose blood is
scary,
it?
right,
Is
but
it
whose blood
right.
is it?
Yeah.
It's not from the baby. It's from the baby pulling the blood from the cracked, damaged nipple that gets mixed in with the milk. They spit that up. All babies spit up. It's normal.
Babies.
Normal to
Posit.
spit up.
It's called positing.
Yes.
It's called positing in my country.
It's called what? What is it called?
Positing.
Like,
Yeah.
yes.
A little kind of flip.
Right.
Yes. And normally it's down the back of your neck. Yes.
When you're holding a baby.
You're holding the
like,
baby and patting
Yes.
and getting a little blood. while
That's
you're
why
feeding.
new moms are often covered in milk stains.
Yeah,
Yeah,
I find that.
Of course, it's a mother-baby dyad. That's what we
Yeah.
call it. They
nice.
need to be kept together.
Nice.
They need to be nurtured together. This is becoming more popular in the hospitals these days, is to do skin-to-skin contact as soon as the baby is
Fabulous.
born. Baby goes right on the mother's chest. There's no more of this like baby born, cord cut, whisked away. Let's clean that baby up, make them like clean and shiny, and then bring them back to the mom all polished up.
No.
We don't do that anymore.
Oh, thank goodness.
We try to facilitate a connection right away because we know that facilitates better breastfeeding, which needs to get off the ground pretty much right away. That's something that surprises a lot of people.
So the first milk that comes through is really, really important, and not everybody knows about what that's called, and why that first feed is so important.
Right. That's colostrum is the first milk that is produced. Women actually have it already when they're only about 16 weeks pregnant, so it's already there.
Wow.
So it's at the ready in case a baby is born prematurely. As soon as the placenta is delivered, that colostrum comes down into the milk ducts and she's ready to feed. And in fact, with a premature baby, the mother's milk adjusts itself knowing that this baby is compromised. So it makes it higher in fat and richer
I did
milk.
not know
That is
amazing.
The body
amazing.
changes it for preemies.
Mm.
But the problem is preemies have a hard time suckling because
Because they're so tiny.
they're so tiny and it takes a lot of energy to breastfeed. But a mom can still express her milk, not really in a pump, that's not ideal for colostrum, but she can hand express, put that in a little syringe tube, and then that can be fed to the baby, and that's important
So important, especially for the
for
premature.
preemies, right?
Yeah, because they need to grow quickly and to develop in this new environment that they really weren't ready for.
They weren't ready for it, that's
So-
true.
and
That's
it-
for sure.
And I'm sure that doulas being there to support the mother through this sudden experience is a fabulous thing to experience.
Yeah, the doula being there for the birth and certainly needing a postpartum doula.
Yes.
And then I want to talk about that a little bit because I think in the New York area there's more of a tendency, just like there's more of a tendency to go with OBs over midwives, it's a little bit more of a tendency to go with baby nurses over postpartum doulas.
This is true.
This is
interesting.
true. Yes. So
Yeah.
what's the difference in the type of service that a baby nurse would offer?
Right. Well, sometimes a baby nurse is fully appropriate. She's going to give 24-hour care, or sometimes you can hire a baby nurse just for night times. But there's a philosophical difference between a baby nurse and a postpartum doula. I have found that baby nurses are great at being all about baby. They're not about the dyad of mother and baby.
The relationship.
Right. And so the baby nurse doesn't say, can I give you a foot massage? Do you want me to make you a sitz bath? Shall I fix you lunch? Do you want me to, I don't know. I mean, there's just a host of things that the baby nurse doesn't do for the mom that are part and parcel of your postpartum work. The other big philosophical difference is they're not usually trained with breastfeeding the way postpartum doulas are.
Right.
That
Yeah.
seems so critical.
I know. They'll say sometimes like, yeah, I have breastfeeding experience, but it's important to drill a little deeper and say, are you a certified breastfeeding counselor or lactation counselor or even lactation consultant? Those are different things. Right. There's a scope of practice that's appropriate for a postpartum doula, and then it goes to the next level. The next level being an IBCLC. So that's an internationally board certified lactation consultant. And so they have a ton of experience and education about breastfeeding. They're bound by HIPAA laws. They use usually a stethoscope and gloves. They get in the baby's mouth. They can diagnose lip tie, tongue tie, all sorts of architectural difficulties that a baby might be having. So that's not something we would ever expect a postpartum doula to do, but she can recognize when the problem is there and
needed.
then refer you. It's very specific to the family, what their needs are, how they're doing afterwards, how much help they have, and so forth, and how their baby is doing. So I have some families I'm working with who have babies with reflux, who are having breastfeeding issues, or, there's so many things going on that they just keep renewing their packages with me. So the way I work, I do like 20 hours or 12 hours, at work. But all postpartum doulas are different. Like some will do all the hours up front. So for example, you came home from the hospital and you've got your postpartum doula 3 days a week for 3 to 4 hours, something like that. I'm just throwing out numbers. So some people may want more care than that. Some people may want less. Some people, like I have one woman who's like, yeah, you don't even need to be here while my husband's home. And then other people are like, please come over every day. So it really varies. It depends on the family. I happen to be very flexible, but a lot of postpartum doulas are not. They're just like, no, I'm giving you 12 hours. We'll use those up in 3 weeks, for example.
So there's no postpartum doula that moves in with you. That's
no,
not
that's a
doula
different
doesn't
philosophy,
do
right.
okay.
I mean, she could if there was some extenuating circumstance. There was one woman who had she was unable to move around with the baby afterwards. She couldn't hold the baby. She couldn't walk without a walker. She had some injury. Yeah. So that's an unusual circumstance where there was an issue with the mother's health and her ability to care for the baby. But no, she doesn't usually move in with you. And so that's what I was going back to with the baby nurse. I've had clients that have had the baby nurse and they have had me. And one thing that they say is like, oh, I didn't realize I was going to have to make meals for the baby nurse or at least provide her with food because she's here 24 hours a day. So that took them by surprise. Also, this little kind of thing of like, well, she sort of expects me to make the cup of coffee in the morning where I would prefer if somebody else did that for me.
Yeah.
And so when I come in, I'm just sort of like, I'm thrown by that because from our perspective, we would never ask a new mom
Oh my gosh.
who's tending to a baby to do anything for us. That's not her place.
No.
So again, it's a different philosophy. It's a different way of dealing. But anyway, the short answer to your question is it's usually several hours over several weeks, and yes, can go all the way up to several months. Sometimes I work with people all the way up until 4 or 5 months, which a lot of people go back to work at that point. But for moms who aren't going back to work, sometimes they just keep in touch with me. They're like, oh no, we were having sleep problems now. Everything was great, and now the baby is going through a developmental change, because that happens too.
Yeah.
You
so
think,
many different stages.
right, people think they can sleep train a 3-month-old baby and be like, free of sleep issues for the rest of babyhood. And it's just very, very unrealistic.
It's a fantasy.
And it's not even evidence-based to sleep train a baby, especially a breastfed baby, at such a young age. They can learn to sleep through the night, but it's a forced behavior. It's not a natural thing for a baby to sleep, 12 hours when they're only like 10 pounds.
Is that where the family bed comes in, where the baby wakes up and the mother can just nurse and then
Well, the family
roll
bed
over?
is,
What's your opinion on
the
that?
family bed is controversial in the United States. It's not really culturally what we do here. Our OBs tell us not to. Our pediatricians tell us not to. The American Academy of Pediatrics tells us not to. Yet it's one of those like dirty secrets that I know tons of people do, but they don't really boast about. There are downsides to it. There are minimal dangers to it. Like they like to promote this idea that people will roll over on their
and
baby,
switch them.
which
Yeah.
really only happens when people are under the influence of drugs or alcohol. But all things being equal, it isn't the best place for a baby to sleep for a lot of people. It just isn't. They're not super comfortable with that. And the way I work as a postpartum doula, I try to really get a child to have some sleep independence, because especially when I'm working with a family where they all need to get back to work sooner rather than later. This is not Scandinavia, where people get a year off once they've delivered, or 2 years off.
Finances. What about health insurance? Do people engage you through health insurance, or is that has
Health
nothing
insurance
to do
does
with
not
it?
cover birth doulas nor postpartum doulas. I'm quite sure it doesn't include baby nurses either.
Right.
Because a baby nurse, incidentally, is not a nurse. She's not an RN. She just got that title, baby nurse.
Really?
She's not an RN, no. She doesn't need to be, unless you have a baby with health issues.
And for midwives, not all insurances cover that either. So I know from my own experience, I did not have my babies born in a hospital setting, and I was told if you had gone to the hospital, we would have covered it 100%.
Right.
But because I didn't, which was a lot cheaper than the hospital would have been, it wasn't covered.
You had to pay out of pocket for that. Yeah, that's the way it is in some places, but that's changing because we've had a little bit of a home birth movement in the New York area, and I think a lot of that happened via the Business of Being Born. That's Ricky Lake and Abby
That was
Epstein's film.
great.
And they really kind of blew the lid off of what it was like to give birth in a contemporary hospital in the New York area, and showing that this is just kind of like a conveyor belt of people, get them in, get them out, get those beds filled and emptied. And they wanted to show a different style of birth. It's a really interesting concept to just understand that our notions of birth have been negative notions that are imbued with fear and anxiety, and this kind of concept that like something horrible could go wrong at any moment, when most of the time nothing like that happens, and a birth is just a normal physiological activity that doesn't require a lot of intervention.
If the baby is a preemie and has to stay at the hospital, do you do your postpartum doula work at the hospital?
No, I wouldn't do that. It would definitely be something that that woman and that baby would need additional care once they were home.
Once they've moved
and
home.
out of the safety net of the hospital. But, they don't release those babies until they're really ready to go home and they feel like they can thrive well on their own. But that's interesting because somebody just called me the other day about that.
Really?
She's like, our baby came quite a bit early and we're moving to this area from New England, and we want a postpartum doula. We don't want a baby nurse. We want the philosophy and the care of a postpartum doula. Can you help us out?
Oh.
Yeah, so
And so you just explained once they make the transition home.
once they make the transition home, then usually they want more care. And in her case, she does want more care. She wants somebody to stay overnight. So I don't personally do that, but several of my colleagues do. So that's the thing about having like a birth team, basically. As long as you know one or two people in the field, we're all connected. We refer to other people. We're just like,
that is one. I mean, this is the village concept.
Yes, exactly.
And I love that because that then supports mother and baby, and it really gives a fabulous start. It also allows the mother and baby to really have the opportunity to bond, which is a fabulous start for a baby. It really is so important, and to have somebody there to advocate for you, and to be your teacher as well. I mean that is amazing. It really is very warming.
Yes. I know. I think that a lot of people they can't really expect for their own family to fill that role. So sometimes I hear people say like, either my family doesn't live in the area, or my mom is not really sure how helpful she's going to be after I give birth. Like I hear that a lot from people.
I'm sure.
And no offense to the mother necessarily. It's just like, what a lot of people say to me is, my mom didn't breastfeed. Or if she did for like 3 weeks and then abandoned it because there wasn't this network of help that there is nowadays to assist
really help,
women with this kind of thing.
That kind of mystery of why isn't the baby doing this, or why is this doing that, and sometimes you need somebody more than just your doctor saying, well, it's just
and a neutral party who can keep a cool head and not be emotionally involved in that way.
That is the thing, right? That neutral, impartial person that doesn't have all the emotional baggage. That's what people are looking for. They're kind of like, I need to. My partner and I need to hear this from you, not from the mother-in-law, or my mother-in-law needs to hear this kind of information not from me because there's too much baggage in there, or she's not going to take you seriously. She's like, you've been a mother for 3 minutes. I raised all 3 of you, and blah 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 blah. And we put our babies down on their tummies, and that's what you should do.
Yes. And so you'll advocate between parties as well, and just be the voice of reason.
I think I'm good at that. Yeah. I like being.
I think you're good at that. Yeah.
You have to kind of wonderful. Be very diplomatic in all of that. Emotions are running high. So.
But yet you provide so much nurturing at the same time. It's interesting. It's interesting.
Yeah, I guess it's kind of it's a balance there.
Nice. And you give classes as well.
I do give classes.
Oh, tell us about that.
Yeah. So in addition to my work as a doula, I'm also a certified childbirth educator. So I've been teaching for almost 9 years now. I love teaching. I've taught in all different kinds of settings. I've taught for pediatric practices, for hospitals. I've taught, I worked with pregnant teenagers in the school system in Jersey City where I live. I even gave Snooki and JWoww their childbirth education
Snooki and JWoww, there's a shout out, okay?
So I've been teaching for a long time, and I love teaching, and I also have my own private practice teaching. So I teach childbirth ed, newborn care, and breastfeeding support. And I also do
Wow.
a new moms group from time to time. A new moms group's a really important thing to do afterwards.
What's involved in that class?
So it's just a support group. So it would be anywhere. It could be like at a yoga studio or community center. Yeah. And it's usually maybe $10. Sometimes it's donation only. A couple times it's free. Like there's a hospital near us that offers them for free.
Oh, nice.
And so there's a facilitator. So it could be a childbirth educator or a lactation consultant or a doula. And then it's a whole bunch of moms, and they're all talking about like how they're getting no sleep and how breastfeeding is going and bottle going and how their partners aren't helping
bonding.
enough and
Yes.
how they don't want to go back to work or how they're excited to go back to work but they feel guilty about it. Like, it's a whole bunch of things.
Support group.
It's a support group. It's a way to get out your feelings. And I think more importantly, it's really helpful to listen to other moms' experiences.
Yes.
How is she doing? Oh my God, she's worse than I am.
Strange things. I just wrote a piece on babies' rashes, and I'm sure you've seen them all. But mums
Very
quite often
sensitive skin.
extremely sensitive skin. Babies, they're very porous and open.
Porous, right.
The skin is still forming. It's still forming, and it's brand new to the outside world. And so a lot can go in, and also a lot comes out. And so if they have things going on with their digestion, which I'm sure Jayne is very familiar with, the digestion is still forming when they're born. And so all these new things that are going on.
Right. And in fact, a lot of people want to put lotions and soaps and creams and stuff on babies. And for a while now, we've been recommending, at least I have in the way water only. Depending on how sensitive the baby's skin is, you could go from 2 months all the way up into 4 to 6 months of using water only.
Oh my gosh.
Yeah, like especially for the diaper area.
And that gets everything clean.
Yeah, it's
Yeah,
fine. They don't, soap is just, that's like a contemporary invention, really.
I think that's
actually
that's an
pushing,
important distinction.
Something that they're not ready for. Their
Right.
bodies are not ready for, especially if you use something that's got scent in it. That's a huge no-no. That's going to bring a rash up like nothing else.
Other than they're still processing the maternal hormones, which are coursing through them via the breast milk.
Yes.
So they may get baby acne and other rashes as a result of something that's completely normal
Baby
physiological.
acne.
Oh yeah,
Yes.
they all get baby acne
Yes.
at like 4 to 6 weeks.
Why? What is cradle cap?
Oh, it's like a
Doing.
secretion
It's
of
a
oils in the
sebum.
scalp.
It looks like
Yes.
baby dandruff.
It's
Worse than dandruff, though.
It's kind of worse because it really is quite a crust.
It's crusty. It looks
Yeah.
gross.
Just
Horrendous.
let that crusty stuff lay there, and it'll naturally work
it
itself out.
naturally goes away, but it's scary to a new mother.
By the way, I had a mom who gave her baby a massage with coconut oil, thinking like, wow, of all, she just thought it was going to be the most gentle and kind of
Closest to natural.
Yeah, closest to natural.
Yeah.
And her baby right away broke out in a rash from it.
Wow.
And before she panicked and called the pediatrician, I looked at the baby. I was like, okay, that's interesting. It's just on her arms and just on her legs. So when you look at rashes, you have, and I'm not diagnosing, but we know that like the torso, right? That she had nothing on her front or back was like curious to me. And she was like, oh my God, it's the coconut oil. I did only her arms and legs. It was really apparent, So, I'm
Coconut
always...
oil is an antifungal, antibacterial.
Right.
It's a naturally occurring part of that oil, but it's too much for a baby.
I was just going to say, I don't think it belongs on a baby. But it's better to use on your nipples
Yeah.
or olive oil rather than the sort of salves that they sell in the store. No, for nipple cream.
nipple cream,
Because
yeah.
those tend to be very clumpy and they can clog the pores. The short answer would be painful nipples are typically about a poor latch. So no cream is going to fix the problem. They're going to fix the symptom. So the best way I can answer that is get yourself to a lactation consultant immediately.
Excellent advice.
Don't let that fester and turn into open wounds that bleed and are so uncomfortable that you're terrified to get the baby latched on again. That's where a nipple shield could come in handy to protect the nipple, but sometimes at that point it's too late. So we never like to let nipple pain. So that's something that I could kind of put out there as like a nice kind of caveat warning, is never ever ignore nipple pain. I personally, that's part of my practice, is that I'm also studying as a sleep consultant.
That is so important. That's another key thing that we get asked all the time here. One of our top selling supplement is melatonin.
Oh, yeah.
And so, we know that with a new mom, I remember being absolutely terrified about sleeping and whether the baby will sleep and grabbing naps and all that kind of thing. There's an art and a rhythm to it, but it doesn't come naturally. You think that you can kind of figure it out, but there are so many times when you really want to ask questions, and it's great to know that there's somebody out there who can actually help you, because if you're not sleeping, you're going to be exhausted when the baby actually needs you, and then if the baby's not sleeping, you're not sleeping.
Well, it's a really complex area to talk about, but I will say that I started out by saying something about postpartum meaning simply after birth.
Right.
But it's used so frequently in connection with depression that some people just think the two words are synonymous, and they're not. And so when we talk about sleep, one of the first things that we try to sort out with a mom who's having any sort of emotional difficulties is how is she sleeping, and what's really at the root of her sleep deprivation. I've seen postpartum anxiety take root in many moms in a way that has been preventing them from being able to sleep at all. And that can be that can exacerbate any postpartum mood disorders that may be sort of brewing under the surface. So,
can you explain a little bit about the way that when the mom has had the baby, the hormones shift, and they take a huge nosedive?
That's exactly what I call it. It's a nosedive. It's literally like your hormones are even. Then as soon as the placenta is gone, the switch is flipped so that she can start to breastfeed. But when that happens, she does a nosedive that's very similar to the drop in estrogen right before menstruation. So for women who've experienced PMS, this is like times 1,000 once you've delivered a baby. And just like not every woman experiences PMS strongly, not every woman has baby blues. But it is common enough for me to be able to cite it at 85% of all women after they give birth have some element of baby blues. So baby blues are different. That's what you're talking about, that kind of like hormonal upheaval that makes you feel weepy and upset and very easy. I think every woman, while she is pregnant, is gathering information and resources just naturally. She's always Googling stuff, always looking at websites that are catered to pregnant women, and she's always looking at, or she has an app that's helping with that, right?
Right,
So
there's always an app.
I think the concept of a doula to someone who's already pregnant is not going to come as a giant surprise. And then her next step for finding one, there could be a dozen ways. It could be via social media. It could be directly from her practitioner. A lot of times it comes from her friend who's already had a baby and used a doula. So that's a common way that the information gets circulated. There's also doulamatch.net.
So important. So if there's anybody out there struggling, anybody out there who feels that they need to ask a question about breastfeeding, about any fidgeting baby, any inability to produce enough milk, any of those things, this is a fabulous time to do it, because we've got the expert right here with us.
And send a direct message if your question is delicate and personal. By all means, send a private DM and we'll get that answered.
Absolutely. So this really helps explain the type of thing, and I'm almost ready to book you. And my babies are all grown up and everything else. The thought of foot massage and cup of tea and
Yeah.
everything else.
We all
Mothering
want
the
to have
mother.
Jane over.
Yeah,
That's what
right.
we call it. We say
Yeah.
it's mothering the mother.
Yeah.
So the postpartum doula is really just helping in a way that's multi-leveled. There's breastfeeding help, there's infant care, understanding about babies, about swaddles, about diaper rash, about sleep